Kirit Modi, MBE, is the honorary president of the NKF. As well as being a kidney advocate, he's a transplant recipient himself. Kirit, welcome to the programme.
Thank you.
What sort of an impact has COVID had on donation and transplantation here in the UK?
I'm afraid there has been a desperate reduction in activity on organ donation and transplantation because of COVID. And that is not a surprise because we all know how busy hospitals were looking after us and preventing us from death from COVID and so on. So the facts are that we've gone backwards. We were making good progress on the rates of organ donation and transplantation in the UK. And COVID has taken us back probably about 5 years. And in particular, if you look at the figures for the minority ethnic patients, the number of people from that background waiting has gone significantly. So just over 2 years ago, it was about 1,800. It's now over 2,000.
So what can we do now to recover?
I think one of the things we can do is make sure that all hospitals attain the best levels of activity on organ donation and transplantation. So if I give you an example, the best hospital in this regard is Edinburgh's in Cambridge. And what are they doing differently? And I think if you think about it, if there is a potential organ available for transplantation, the doctors, in liaison with the patients, decide whether it's good enough to be transplanted. So it's a level of risk you're prepared to take. And I think Cambridge is very good at using as many organs as possible, which other hospitals need to learn from.
You mentioned minority ethnic communities there. We know that historically the figures are very low in terms of the number of people donating. Why do you think that is?
It's a very complex position here because you can't treat all minority ethnic communities as one. We know how complex that is. So there are different issues facing different ethnic minority communities. But the key areas are usually cultural issues, sometimes religious issues. But the most important, I think, challenge we face, there just isn't enough awareness about organ donation and transplantation in those communities. So if you look, for example, the law on organ donation in England changed to opt out 3 years ago. And if you look at the impact of that law, all right, it was during the COVID period. In fact, we've not really found the potential, the full potential of the impact of that law. And that law says basically is that unless as an adult you have signed to opt out of the organ donation register, it will be assumed that you support organ donation, are willing to donate. And in particular, within ethnic minority communities, that's a big challenge.
So what can we do to address this now?
I think the main thing ethnic minority communities can do is take a leadership role in promoting this within their local communities. Because we need trusted messengers giving the right message. And it's a complex message, as you know. So for example, if I give you next weekend, I'm going to a temple in Chigwell, a Hindu temple, and we'll have about 400 people in the audience, and we're talking about organ donation with that group. So it's done within the temple by people that the audience will trust, and therefore it has the maximum impact. Obviously, we work with the doctors, we'll have a doctor there, and we'll also, this particular project is funded by NHS Blood and Transplant. So those are the sorts of projects which are happening up and down the country.
Okay, sounds promising. Things are moving on in the right direction. Okay, Kirit Modi, MBE, many thanks for joining us.
Thank you. Thank you.